Hi, my name's Kelsey Hegarty. I'm a general practitioner and I also am an associate professor at the Primary Care Research Unit at the University of Melbourne. I became passionate about the area of domestic or family violence when, as a practicing doctor, family doctor, I read the figures about how common it was. And in Australia, it's 1 in 5 women have ever experienced physical or sexual violence. And I was thinking, I don't see that. And so therefore I became interested and did a PhD in this area. And now I lead a researching abuse and violence group within my Department of General Practice. And what we aim to do is really to improve women's, children and families' lives through addressing the issues of domestic or family violence. And that's not an easy thing to do because in my state of Victoria, it's the leading cause of death and disability for women of childbearing age. So that's really significant public health problem. But also the issue is that general practitioners are not, or family doctors are not recognising this issue. There's barriers for women to tell about the abuse. It's a very hidden stigma to talk about it. But the doctors are not inquiring in any way. So we've done a lot of work in this area and we've shown that it is very common in women attending general practice. Probably a full-time doctor is seeing about 5 women per week who've experienced it in the last 12 months. Now that's not people who are presenting with it, they're presenting with chronic pain or other psychosocial issues such as not being able to sleep or depression. But the doctors are seeing that many people. So we know it's common, we know it causes ill health, and we know that it's not being discussed in the consultation. So as a result of this, we decided to develop a project we called Weave. And the aim of Weave was to see if brief counselling by doctors for women who are fearful of a partner could make a difference to women's lives. And so we've been doing that for the last 3 or 4 years. And the project involves quite a large project because we screened around 6,000 women attending about 55 practices or general practices or where family doctors work to see how fearful they were of a partner. And we screened amongst other lifestyle type issues such as smoking or alcohol so that we could keep the women safe when we sent it to them. And just under 13%, 12.9% of women were afraid of their partner or their ex-partner in the last 12 months. Now this surprised a lot of the doctors involved in the study. And what we then did is we randomised the GPs, so it was a randomised controlled trial. So we just picked out of a hat. Half the doctors were trained quite intensively to respond to the women who were fearful, and they invited them for some sessions of supportive women-centred counselling. The other half of the GPs were just given a resource kit, and the women in both groups were also given a resource list for safety. Now what did we find? We found that the women who were invited and went to the trained GPs were asked more about safety of women and their children. They also had less depression. Now we didn't make a big difference to their overall quality of life or global mental health, but we think what this study shows is that doctors can do this work. Doctors can help women, and even if they're just discussing the safety and the women are feeling better, we feel this is a promising start. And we now want to work with, in other ways to deliver this sort of intervention. One way might be with computerised responses, and the others is trying to work with the rest of the family because doctors see the whole family. So we're going to develop interventions for children and men. And what we hope as a group, our Researching Abuse and Violence group, is that we make it safer for women and children in our community. Thanks for listening, and please contact me if you'd like to hear more.